We're gonna call to order the Suffolk County Health Department Board of Health meeting at 6 o'clock. We're gonna have an invocation by Commissioner Gibbons.
Would you bow your heads with me? Our Heavenly Father, we thank you so much for your many blessings. We thank you for all that you allow for us to do through the health department to aid and care for the citizens of our community. As we gather this evening, we ask for your guidance and your direction so that whatever we say and do might be pleasing in your sight and that it might be with the best interests of our citizens in mind. For it's in your name we do pray. Amen.
Amen. Amen. You have the agenda before you. Are there any changes or additions to the agenda? Have you done? All in favor for adopting the agenda, please say aye. Aye. Those opposed, say no. The ayes have it, and the motion is carried. Okay. Next are the minutes from October 18th and December 13th, 2022. The minutes were distributed in your packet and minutes were passed out. Are there any corrections to the minutes?
Madam Chair, there being none, may I offer a motion to approve the minutes from the October 18th and December 12th meetings?
There is a second? The motion is moved and seconded that the minutes are approved as distributed. Do we have any public forum, anybody from the public that wants to speak? Okay. Moving on to the next items on the agenda are the administrative reports. We have Tim Martin, our finance, with the fiscal update.
Good evening. This is the financial update as of January 31st, 2023. The first slide we will look at is, I'm sure most of you are familiar with the 10 essential public health services that we are required to. Accreditation requires any financial decision made by this board is led to not understand what this means, so that's why I have to have it on this slide. So, any questions? Okay, the next slide will be our operating budget. As of January 31st, 2023, we should be at 58% used. As you can see, as a total health department, we're currently at 44.8% used, so we're currently under budget. In almost every area except for 2 immunizations is because we've had some raising costs of some private immunizations that we've had to purchase. And once again, the administration budget is because when the budget is cut, they don't cut in all my programs, they cut in the administration budget, and I have to find money all during the year to put back into that budget. Any questions? Okay, the next screen will be our revenue collections. Once again, as of January 31st, 2023, we should be at 7 months collected, not 582% collected. I think that was an error I made. But 58% collected, as you can see. Any questions on that? We're currently under budget on revenue collections.
Is there a specific reason that we're so far under budget? Thank you.
Currently, the system, I will say that I have 2 new staff that have been here, and they are doing an outstanding job, and they're getting everything caught up and back billed. We had some staff before that we realized were not doing what they were supposed to do, and they were not billing stuff correctly. So that is why it's a little behind, but it's catching back up with that. Once it was behind, one point in time, we were behind 2-3 months on billing. Now we're caught up to probably a week since my 2 staff that came on done such a wonderful job.
So do you project that number is gonna be increased real soon?
Yes, sir. The number that's budgeted is based on the amount of patients that we just thought we would be seeing this year.
Right.
And if the patient clients go down, then we, of course, we won't come into that number. And our patient count has reduced some.
Thank you.
Okay, on to the next screen. This just gives you an idea. I know we have some new people on the board, and I did want to give everyone an opportunity to know where some of our funding comes from. These are the federal and state grants that we actually receive. So if you hear us say AAs or agreement addendum, this is what we're talking about. You see maternal health, general aid to counties, family planning, adolescent pregnancy prevention, and on down the list. I do not have the numbers for WIC for next year. They have not sent those out, or the breastfeeding care counseling. But these are funds that the state gives us to operate the health department in these programs. Any questions? I know we have $100 for STD prevention, so I'm not sure how far that will go. Or $500 for HIV, so. The next slide is, I know we had some questions previously about some of the COVID funding, and I try my best to give as best answers as I could. We currently have, 5 grants that are currently operating through COVID funding. The big grant, which is the 543, which was the original grant we got for contact tracing from the very beginning. We still have a balance of $205,000 on that grant. The COVID vaccination program, 212, the school position, 107, the CD pandemic, 100,000, and the other school grant was 157. We have been using the school grant since we hired 2 temporary staff, and so their salary and some of their equipment and stuff is coming out of those lines. Please note also the ELC at the top, the $205,000. $83,000 of that is earmarked to the mobile vehicle when it's complete. And that 212 for a vaccination program, I think it's $50,000 earmarked to put the breezeway across the sidewalk here, all the way to the parking lot. Any questions? I did put on here for 361 to let you know that that funding does run till 5/24 of 2024. Same thing with, that should be 23. Okay. The 361 and the 620 as of May 31st will be going away. That funding will no longer exist.
That was gonna be my question. So do we have a plan to exhaust those grants before then, so we don't have to get that money back?
I will have to defer to
Yes.
Ms. Amanda.
Yes, I'm working with Donna and Tim on some projects. We talked about our general clinic, remodeling some of that. We can use some of the funds for that. Our waiting room, what was it, freezer, wasn't it, Donna? for
Yes, our
vaccine?
vaccine storage unit is, the compressor going bad in it.
And we also talked about possibly some vehicles, because our vehicles are pretty old. And we've been loaning our vehicles to DSS. Just want to let you know that. DSS, that wasn't brought up in the commissioners' meetings, but DSS does use our vehicles and have been for quite some time. Make you aware of that, and now our vehicles are pretty.
When did you say that had to be used
By
by?
May 31st
Of this year?
of this year.
361 and 620 have to be used. Those are our school health liaisons. Now, that money has to be used towards their program with the school and their supplies and computers. We've identified some computers that needed to be replaced with those as well. Now, 546, we'll only have it through December. So, you've got to get some plans on this and that as well.
And the 543 and the 716 will go to May of '24. So we still have that for another whole fiscal year.
And we were using the 546 funds for our HIV case manager, but she resigned. And we were advertising that position, but we haven't had any bites, have we?
There's one potential.
We're using that money for that. And I've also been told recently that we could use that money to help fund some of the lab costs for PrEP clinic if we start a PrEP clinic for HIV prevention.
Any questions on any of that?
Question, do we have like a number for how much you are expected to spend before we would like have to do whatever we don't use back? Like the projected cost of like how much are the computers, so we'll know how much we would.
I can promise you it's not the amounts on that piece of paper.
Yeah,
That's a lot of money. I don't believe, especially with some of the COVID funds we have leeway with and what we can spend it on, those school funds are mainly for doing stuff with the schools. And there's not the side there that they have been going to the basketball games and football games and different stuff, doing stuff, but there's no way that amount of money is ever gonna catch up.
but I just wanna know like, what's the number, so we'll know what we didn't spend, like, that's kind of like to help going forward, so we can make sure we use, if they giving us the free money, we wanna make sure we use it for the people, so.
We don't have those quotes or anything yet.
Yeah. Okay.
And just a reminder, we do the AAs on an accrual basis, which means we do not get the $125,000 at one time. We get it, and then we have to spend it, then we go ask for reimbursement. So we're not necessarily sending anything back. We're just not getting what we're available to get. Does that make sense?
Yeah, I mean, I know it's not,
Okay.
not kidding, it's just that, that's kind of easier term, just saying.
Yes, ma'am, I understand.
And also, some of this funding has been for previous years, and the money wasn't spent.
And the grant just ends.
Mhm. We were just told, I think last week before last, that it was coming to an end.
Because it probably was tied to the, pandemic. So.
Yeah, the state is
Once it ended.
getting very creative in how we can spend this money, because first of all, they were like, you have to do this, and this. You have to send in a budget for what you're gonna spend it for. Now they've kind of relinquished those reins a little bit, except for that school side. That's specifically meant for school projects and COVID inside the school system. Any other questions? Thank you so much.
Next on the agenda, we have the monthly activity summary. Ms. Beasley, you have the floor.
I think these were in your packet. These are the services we provided for December and January. I have been sending reports every month, so I just kind of wanted to get a couple of the highlights. In December, we had we recognized World AIDS Day with the candlelight vigil here on December 1st. And we had about 25 participants. We had open house for the public on December 15th, where we had Mr. and Ms. Claus, and we had about 65 people participating. Tim, myself, and Donna, and Sharon, we visited Greensboro at the Matthews Specialty Vehicle Plant to look at the plans and stuff for the mobile unit. And I think I mentioned before that there was some delays because of parts. They were having trouble getting parts. The school health liaison started on December 16th, and since that time, they've kind of hit the ground running. They participated in setting up some tables at the middle school basketball games. I think they're doing a parent-teacher open house or something next week. And they're in the middle of planning a school health fair for the end of the school year. I met with Rita Cardenas of the Regional Infection Prevention Team. And she is a nurse who is coming into our residential facilities in Scotland County. And their goal is to reduce the spread of infectious disease within the facility. She does, works with the staff on proper hand washing and safety precautions. I did issue a mask mandate for the health department due to high community transmission level in the 1st of January. However, the last 2 weeks, our numbers are low, and I'm anticipating them being low for this week as well. So we will probably be lifting that mask mandate at the end of this month. There's also a COVID kiosk, which we're gonna have a video on here shortly. The state is following some information that they got from Georgia, where they set up kiosks in areas where it's underserved population, to where they could go and do a self-test, but yet get results. Because we also found that a lot of people are doing self-tests at home, that those numbers aren't being reported to the state. Or if they need a letter to go back to work and you self-test, you don't have a letter from a physician. But the kiosk that we're looking to get, and it should be here in a couple of weeks, and we'll see a video shortly. You could enter the information before you leave home, or you can enter it once you get to the kiosk. The kiosk is gonna be in front of this building, in between DSS and the health department. You go up to the machine. If you didn't enter your information on the computer at home, you can enter it into the kiosk. It'll drop down a test. You can take it back to your vehicle, test yourself, put it into the bag, take it back to the kiosk, put it in. You scan the code that's on there, or either put your email address in, and within 48 hours, you'll have your test results.
Is that a PCR test?
Or,
Is it PCR?
Can I ask a question here? I thought that with these kits, you do it yourself. You do the procedure and then you get your results right then. Why do you need to send it off?
well, a lot of people are coming here and getting our self-tests that we have here, but if they test at home, those numbers are not reported to the state. And so it kind of skews the numbers a little bit for the state on how many positive cases you have. Plus, you also have some people that are doing the self-test at home, and then they test positive, they call the employer, hey, I tested positive for COVID. Well, okay, you gotta have a note to come back to work.
And also the rapid test, right, well, we are a community access point right now. But a lot of the tests that they have available are going to be expired soon. All of the emergency funding for COVID in general will be ending in May or December, but mostly in May. So those tests are expiring, and there won't be a lot of those tests available for free anymore, just like COVID vaccines won't be free anymore after that. So it's gonna be a way for people to be able to test, and PCR send-out tests are more reliable than the rapid test that you do yourself. And some people don't do those tests very well either. They have a little bit of a hard time understanding the instructions and making it, do it the right way.
Is it a cost, like, do they have to pay test for free?
And that machine also has the option to distribute, you can use it for other things like naloxone.
Yes, that's
Like
one of the add-ons that the state's talking about, is starting out with the COVID test, but at some point, using it for other things like that. We also had 2 dog bites in January, and we quarantined one of those dogs at the animal shelter because they could not show proof of rabies vaccination. And the other one was quarantined at home by the owner because they were able to keep it quarantined. And that's pretty much the highlights.
Thank you, Amanda.
Next on the agenda, we have the department reports.
I don't have anything major. We are fully staffed with nurses right now. That's a good thing. One just went out on maternity leave yesterday, but, but we're fully staffed. We're still, two are still in orientation, but we are fully staffed. Knock on wood. All this is in your packet.
Ms. Deb, do you have anything you want to add to your? No, I don't have anything unless they have some questions. Kathy, do you have anything you would like to add?
The only thing that I have, if this is the perfect time to talk about Thursday night, I just wanted to remind you all, we've been talking about, and you've probably heard over the radio and newspaper, the opioid community forum. This is our third one that we are providing, and this will be Thursday night from 6 to 7:30 p.m. I'd love to invite all Board of Health members, if you'd like to come, to see what this event is all about. It's open to the public. It is at the Laurel Hill Community Center, so if you haven't had a chance to see that center, this might be an opportunity to do that. It's going to be held in the Eagle Room, but we do have flyers out here if you want to post them. But please, it's the Opioid Community Forum, and what happens there? It's a discussion about the data and about what's actually happening here in Scotland County as far as overdose and as far as EMS. I do have some data I want to share with you right now. And this is data from 2020 to 2022. How about this? Narcan was administered 169 times in 2020 with 12 deaths and 113 ER visits. This is 2020. In 2021, Narcan was administered 195 times with EMS being dispatched to 197 overdose calls. And then in 2022, EMS was dispatched to 217 overdose calls, and Narcan was administered 184 times. The number of deaths associated with drug overdose was not available for 2021 or 2022 at this time, but I will say the North Carolina Department of Health and Human Services is reporting that there has been a 22% increase in overdose deaths since 2021, and it's alarming. And so this is happening right here in Scotland County and across our state. But, when we go to these forums, we learn about what the resources are, that people that are in crisis, it's critical to health behaviors, what resources that we have available. Those participants are shared this information. We have personal stories, one or two of them. We have resources there that talk about what they have on hand that they can provide the participants or family members of someone who may be a user. And also there's a Narcan demonstration. Our EMS director comes and shares with everybody. So you can actually see how many in here have actually seen the use of Narcan or has had to use it. And if you haven't, it's something good for us to know. But there's a lot of data that we'll share, plus personal stories, like I said. And I think it's important for all of us as key community members to participate in things like this, because the information and resources that you learn about, you can help us promote awareness and prevention efforts and resources that the normal person or those that may be in that trend may not know about. So that's kind of what I wanted to share. So Thursday night at Laurel Hill Community Center, 6 to 7:30 p.m. And we try to keep it to just that. In the Eagle Room, please, if you can, come out and visit with us and see what that's all about. And if you want this flyer to take with you, we have a couple in here. You're welcome to take it. I know this is kind of like 2 days before, but this is our third one, and we are going to continue with events. And so you'll learn about what's going to happen coming up in the future as well.
Thank you, Ms. Berry.
The next item of business on the agenda is unfinished business. We have none. We'll go on to new business. The performance evaluation policy. Shannon.
So we've been discussing, in previous Board of Health, meetings, regarding the evaluation process of the local health director. But before we get to that point or to that topic, I would like to draw your attention to, the changes or the proposed changes, that has recently taken place. I did want to provide some information. I don't know if any of you may have heard about the Administrative Code 25. That is the code that we go by since we're identified as state employees. It is the type of appointments and duration. The Administrative Code defines services to local government, and also county policies must be in compliance with this code. And just to provide you a definition, the length of the probationary period should not be less than 3, no more than 9 months of either full-time or part-time employment. Back last year, I think it was in September, Commissioner Gibson, you can correct me if I'm wrong, the Board of Commissioners approved to amend the probationary period from 12 months to 9 months to be in compliance with this administrative code. It was approved and it became effective January 1 of this year. How does this change affect employees in their current probationary period? So pretty much if employees were hired before January 1, they would remain on the 4, 8, and 12-month probationary evaluation cycle. Those employees hired after January 1st of this year will be subject to the new 9-month probationary evaluation cycle every third, sixth, and ninth, or the third, sixth, and ninth month. Now we get to the task at hand of discussing the performance evaluation process for the probationary annual evaluations for the local health director position. So pretty much what will remain the same, the position will still be evaluated at the 6th and 9th month mark during the probationary period. And the position will still be evaluated on an annual basis after completion of the probationary period based on the position hire date. The performance evaluation policy was included in your packets. These are the proposed policy and procedural changes. Before I go any further, are there any questions?
Were these changes submitted to us from the state?
No, these changes were submitted. What I did was I pretty much spoke with Amanda to see what she was already doing. She was sending her performance notes to the board. And I did contact other health departments to see what their evaluation process was for their health director, and pretty much came to a consensus of this process.
So can you summarize for us what the difference will be in
Sure.
how it was done and how it's done?
Sure. In the past, I'll speak on the way it currently is with employees. We do current employees, performance evaluations are administered through NeoGov. The way the process is pretty much set up, there are before ratings, or the employee will have a chance to self-assess themselves. As opposed to the health director has not been provided that opportunity to have a self-assessment of their position based on the job description. So we've implemented a self-assessment, which I included a copy of that on your, well, it wasn't in your packet, but it's on your table. The key players in this process will be the board chair, also the county manager. In the past, and I went back through previous minutes, Board of Health minutes, to try to find the exact time of when the change went from where it was back then to NeoGov, because in the past, the performance evaluation was conducted by the Board of Health. it was not conducted, or, the direct reports were not contributed to the performance evaluation ratings of the local health department, the local health director. It was strictly the Board of Health. I don't know what happened that changed that process. I couldn't find it in minutes. But like I said, the county manager would be, the board chair and the county manager would play a huge part. The county manager, as we all know, the local health director is accountable to the county manager. Who else besides direct reports would know what the, health director, how they're performing other than the county manager? And also, the board chair, you yourself as a full board, you also would play a huge role with the creation of a evaluation, performance evaluation for the local health director. I did have a sample template, but I felt like I was gonna push that to the side and see what your thoughts were, your ideas, in terms of creating a evaluation. I do feel like, and if you notice, bullet point 3, the board chair, with regards to, the chair may or may not solicit additional feedback, including from senior management staff and direct reports at the health department through electronic or in-person methods of each performance period. The board chair is up to their discretion of whether or not they want to include that feedback from senior management staff and direct reports. That's another major change. The way it's set up now, the probationary performance evaluation is strictly done by direct report. And I'll let Amanda, if she wants to elaborate on how she feels about that, how the current process is now.
I had never heard of direct reports evaluating their supervisor like that. I feel like as their supervisor, it makes it difficult for me to make corrections or changes that need to be made if they in turn may get upset and my evaluation could be, a little skewed on that, how they feel about that, instead of a true evaluation of what I'm doing. So I don't feel comfortable with them evaluating.
Well, Madam Chair, if I can, because I don't want it to seem like just yourself and, Ms. Sharon, I think we've had that same concern as a board with our previous health director and even with Ms. Deaver. For those who are new, I think those of us who've gone through that evaluation, this was a concern we raised, about trying to find a way that it would be more, top down rather than bottom up, if that makes sense. And so, I like it. I like that it allows everybody to have some input. And then the board, because although she reports, our health director reports to the city, to the county manager, ultimately, this board hires and so I think I like the way that it's set up to allow the assessment from the health director, county manager gives some input, staff can still give input, but of course, the final evaluation is left to this board. I think that's a wonderful mechanism to use, in my opinion.
Could we see your evaluation template that you have first?
Yes, unfortunately, I do not have copies of that template, here with me tonight. But in April's meeting, I could have that ready, or what I can do is after the meeting, I can send that out, to the board members. And I encourage feedback. Definitely, and also we'll be working with, Susan. Susan has been, helping me out a lot, with this process, bouncing ideas back and forth. So yes, I encourage your feedback, any type of, performance criteria you want to add or edit, change, let me know.
Yeah, may I make a comment if that's possible? I will say as a direct report, it's very tough on us to do an evaluation on our health director. I mean, it really puts us in a tough spot and a compromising position, I should say. So I would request, if possible, that we have less to do with that if possible.
And I think you're right. I think this whole thing here should be eliminated. everybody knows whether you're doing a good job or not. I believe you are. This is just something to take up time and waste the money and waste the assets of the board. We get this money in to do things with, and then we waste it on evaluations, and we waste it on certifications, and we waste it on just a bunch of stuff that just gives somebody in Raleigh something to do. If we could reject this, that would be the greatest thing in the world.
Well, I'd like to reiterate what the commissioner said, because when I was first on the board, this is my 6th year, I was quite surprised at how this was presented, and I thought that it put everyone on the spot, not just the director, but it put every individual on the spot. And you may not have been here at the time, I can't remember, but we had a discussion because there was some funneling into negativity. And as I brought up at that time, you could flip through it and see there was one particular individual throughout. And you didn't know who it was, and people could surmise then, but the negativity towards that one director was 80 to 90%. You could surmise that it's the same person all the way through. And so we elected, I think, as a board to just negate that one and take it out as a null, because it didn't agree with all the others.
Mhm.
And that was the only way I think I could deal with it at the time. But I would hate to be in a position, as you said, because it's a very difficult situation to be in, because their person is helping direct you. And I really think it needs to be flipped. I really do. So I would more agree to this than the previous way.
So do we need to make this a motion?
Yes, or do you want to wait until you review the template that I have?
Can I review
Or are
the
you-
policy?
Yeah, the board can go ahead and approve the policy, and all the procedure stuff we can take care of.
I want to ask something to a question.
Yes,
With this assessment, self-assessment, just my knowledge of evaluations, once she does hers,
Mhm.
shouldn't whoever the evaluator is have that same criteria for which that they're gauging, so that it's a direct match?
Are you talking about the board?
Yes.
Yes,
So she's doing this, and you're saying you got to
Yes.
create one.
yes.
Why wouldn't it be the?
It would be the same, it would be different, of course, a different format, but the sample performance evaluation I have, it mimics the job description. The self-assessment mimics the job description, so
Okay.
that's what you will be rating.
So basically, it is the same, but you just have to change it so that it's suited to us,
Yes,
or whomever it is.
yes.
When is our next date for evaluation?
It's coming up June, so it'll be May.
Only ask because if it was sooner, we need to go ahead and move this. If it's
Yes.
that far out, then we can do this in April.
Well, let me see, it'd be 30 days to get this process in motion. And really, like I said, the key players are the board chair and the county manager. Timing is going to be of the essence here, because you want to make sure that you have the ratings in before that next meeting. So with the next Board of Health meeting, what is it, April? Amanda's evaluation should be due May. So we'll probably be going May, June. So if that would be perfect, because we have a Board of Health meeting in June too, right? Yeah, so that the timing would work out great.
Sharon, would it not, I mean, with our evaluations that all of us have to do, would it not have a lot of the same components as ours?
That'll be up to the board chair and the board, if they're wanting to implement some of what we already do now in terms of the performance criteria. If they want to implement that from the senior management staff or direct report staff, they can, but it's up to that individual's discretion. They
Because
want to,
we, as a staff, we all have a standard format in our evaluations that everybody in the health department is evaluated on. So why wouldn't the health director be evaluated by those same standards? And maybe some extra because she's the health director, obviously.
yeah, I can, certainly provide what, the current ratings are, and send that out to you as well, if you want to include that criteria in as well. I think there's a part in there, I think it's a 5-year plan or 5-year goal, that individual would draw out in NeoGov, and then that's a part of the current process now. But I will send that information out to you as well, and again, I encourage feedback, let me know what changes that you would like to see. But it will still be centered around that job description.
Is there any way we can just reject this out of hand and not do it?
I think about
Sir,
it, like, oh, we have to do.
Everybody has to have one of those.
We all have to.
And I mean,
If you work here, you have to have an annual evaluation.
If you work in government,
Gotta have it.
Yeah,
It's
because
required for accreditation.
yeah, that is for, exactly, it's part of.
All you gotta do is say that.
Yes, it's part of accreditation. Yes,
Who says
So
we
are
have to
we
do it?
laying this on?
accreditation says you have
This
to.
is Dave.
Accreditation.
Yes, sir.
Well, just the golden rule, who has the golden rules, is that it?
Well,
We don't
we're
like
gonna,
it.
yes, Sharon, we're gonna table this to the next.
Okay,
but we want her to send us that information
Yeah, so we
to
can,
yes.
review.
so if we have to call a special call before then, can we do that? To get it in motion?
Any board member can call a special meeting, if y'all think that's beneficial, which I think is a good idea.
Yeah.
Uh,
The month,
Yeah.
That's a long time.
yeah, that's fine.
The next item of business is the tobacco-free policy.
Yes, I'm gonna let Ms. Graham present, the reason why we are changing our tobacco-free policy.
Good evening, everyone. Good evening. So, tonight I'll be talking to you all about the managed care, and the managed care plans and the tobacco-free requirements. Just as a highlight, I know we just mentioned accreditation, this also applies to accreditation. Activity 30.9 does require all health departments to have a tobacco-free campus and space. So in that, you would have to have a tobacco-free policy, and then you would also have to have signage and promotion of cessation that would allow you all to comply with that accreditation requirement. So as of April 1st, this deadline was actually extended from December 1st of 2022. The individuals or companies and organizations receiving Medicaid funding are required to have tobacco-free policies. So that will mean that if you are under the standard care plans or the tailored care plans, then you would have to comply with being 100% tobacco-free. A lot of people have questions whenever they call in and they're like, hey, do I fit in that category? If you are a medical provider, if you provide behavioral health services, if you provide residential or non-residential care for IDD or TBI patients, then you do fall in this category, as well as local health departments and emergency services. The only people right now who are not falling under these plans receiving Medicaid funding are actually retail pharmacists. And I've seen in the work that we're doing now that the pharmacists are actually really interested in this work because they get those direct questions about cessation. So just a little highlight on North Carolina and why this is so important. We have about 1 in 3 people who are receiving Medicaid funding who actually have a history of smoking. Although the claims looks like it's about 1 in 10, typically you do have about 1 in 3 people who are smoking are using tobacco products. Overall, even looking at individuals who don't receive Medicaid, we still have about 1 in 5 people that are smoking or using tobacco products. And as we all know in here, tobacco is the number 1 preventable cause of death and disability among North Carolinians. So that's why it's important. So if we put the health disparities out, the health issues out, we're still looking at a high cost for Medicaid. So Medicaid is actually one of the largest preventable costs for tobacco use. And the CDC estimates that about 15% of the budget in North Carolina alone goes to tobacco-related healthcare costs. It's estimated that if we do about 1% of decreasing smoking or just doing smoking cessation, when the individuals do stop and quit, frequently they have multiple quit attempts, we're still gonna save about $52.2 million if we have a 1% decrease in North Carolina. Yeah, so that's why, even if you're looking at, people have the freedom to smoke or use smokeless tobacco, you still need to look at the Medicaid costs and what we could do with those funds in our counties and local governments. So what does 100% tobacco free look like? For us in local health departments, it would apply to all of the venues we use, so our buildings, our any property that we lease or rent, our vehicles, the grounds that we actually have around our facility, meaning our vehicles that we drive to work, we cannot sit in and smoke or vape or use dip or any other types of tobacco products. The policy would have to entail the use of combustible, electronic, heated, and smokeless tobacco products. So it would have to be all encompassing. We wouldn't have any designated tobacco areas. And then we also would not be able to purchase, accept donations, or distribute any tobacco products in order to have a 100% tobacco-free campus. So, as you guys think about passing the policy here in Scotland County, we just want to encourage you all to be proud of this policy, be proud of having clean air, being confident in offering evidence-based treatment to your staff and your residents. Make sure you're communicating in advance. This is a really big one. We definitely want to communicate in advance because we have staff who smoke. We have clients who are used to smoking in the parking lots before they come in. We have people who are actually addicted to nicotine. So we need to be mindful of that, make sure we're making the necessary referrals to the quit line and making sure they have those resources available. One big thing is making sure you have accurate information. As a regional tobacco control manager, I make sure all local counties, we have 10 counties in our region, I make sure all of them have the most up-to-date information from the CDC and the Tobacco Prevention and Control Branch. And then any education opportunities that come about, I make sure they are filtered out to the counties as well. Another thing, once we pass tobacco policy in each county, I provide signage to them to make sure you have it properly labeled outside of your facility or agency or organization. It's important that we update our websites, making sure that the materials are consistent and that they reflect the change. That way, families, patients, whenever they're coming in and they're receiving services, they know what they can and cannot bring. And then the biggest thing is making sure you're ready. You're ready to talk about the concerns of the staff and also your patients and clients. Any questions? Yes, ma'am. Question.
Does this include parks areas too, because it's county? Is all inclusive? County, parks, trails, things like that, or is this just?
So for this policy, it's only for the organizations that receive Medicaid funding.
Okay.
So we can do county ordinances, and that would be going through, the Board of Commissioners and doing county ordinances and putting those in place, and that will cover the parks and the county buildings. Right now, Scotland County Health Department has a 50-foot perimeter. You cannot sell or vape inside, and then a 50-foot perimeter. With this policy, it would be the total campus that, Scotland County Health Department covers. We do also acknowledge the fact that they are conjoined with with DSS. And ideally, it would be great to get both organizations on board. We have done it in a few of our counties in our region, but tonight we're focused on the health department.
And I will say DSS is not in that.
And I
So-
will say that I have, addressed this with the county manager, and he's not open to making this a whole county.
That makes it kind of difficult though, because you're joined together, you're really literally on the same property, so to speak. So clients here can just walk 10 steps.
Wow. So that's the issue that we do see with it. It is encouraged to have both organizations tobacco-free, but we have to start here to make sure that we don't lose any funding for Medicaid at the health department.
My question, thank you for this, we really have to do it because we want to maintain our funding. What I want to ask you, Ms. Deaver, is I hear that you talked to Kevin. Have you talked to April?
To April, no.
Okay.
I met with Kevin twice already, and he said he was not comfortable making it the grounds of all the county facilities. He said unless it was in general statute.
Okay.
And that would be a great start. I think just us making sure that we're presenting it and telling them why it's important to have that policy in place. It does happen in counties, but it takes more time. I know I'm based in Cumberland County now. I'm gonna start here. But I'm
Don't
based,
say that.
yes. But I'm based in Cumberland County and they do have a countywide policy. Moore County has a countywide policy. So it does happen in our region, but it takes more, guidance from our health director and the county commissioners working together to do that, and the county manager. But we want to definitely make sure by the April 1st deadline that our health departments are all tobacco-free. Because if they are audited and they are not tobacco-free, then that's where we run into issues with funding.
So I'd like to offer a motion that we adopt this policy, for the tobacco-free policy.
I'll second that.
Saying that you stated EMS was part of that deal?
Yes, yes.
It's a motion on the floor. It's a motion on the floor. It is moved and seconded that the tobacco-free policy be enforced. Is there any discussion or debate?
No, I was just asking.
And we can go back to it.
That is.
They receive Medicaid funding.
Are you ready for question?
Yes, ma'am.
The question is on adoption of motion of the tobacco-free policy. Those in favor of the motion say aye. Those opposed say no.
No.
The ayes, there was one no. Yeah. The ayes have it, the motion is adopted.
So to answer your question, EMS does fall into the category, so all emergency services would have to comply with this as well. And they
That's
too
right
have been
there.
audited. Mhm.
That's enough. Okay, so what I want to ask as a county commissioner, I understand Kevin's perspective, but we have a policy committee and we review policies and make that decision for the county. I think on our next meeting, you need to be present if you can't, or during your presentation, it'll be good to have her come and expound on this information so that your board of commissioners are knowledgeable. And it won't be you want to overkill or anything, but we need to know as board of commissioners what this board has decided. And it affects more than the health department. It affects, as Ms. Donald just said, so that needs to come to our board of commissioners. And then we consider whatever other things need to happen.
Could you come to?
It's the first Monday.
Next Monday?
Oh, no,
First
Monday in March.
Just
Have a
for,
question.
oh,
I'm gonna go ahead.
just for clarification being, with the EMS services, that's also included in this, they also get funding from Medicaid as well? Okay, so it's kind of one of those things to keep things functioning. They said this is tied to us getting our moves, we kind of have to do it. to
Yes,
stay
ma'am. So
functional.
even, are you in the office or a hospital?
I'm in the office.
Okay, so your office would actually have to comply with the signage as well, making sure that you're showing that you're tobacco free if you.
So I was gonna
So
say-
all the doctor's offices, not just the health
Anyone who
department?
receives Medicaid.
Anybody
Who get like medical, like Medicaid repayment? from,
Yes.
You know, you pay for our
So
Medicaid
that's
like here.
any medical office, not just
That's
county
gonna be-
office.
Not just
mean,
county
Who's
office.
gonna tell us
Across the
that?
state.
Who's gonna tell us?
Yeah, I'm gonna say.
Yes, this is
Wow.
By April 1st, this is one of
How
the.
to implement this.
Yeah.
That receives Medicaid funds.
Yes,
As a payment for services.
yes,
I think it's been in the Medicaid bulletin a couple of times already.
it has, they just, because the deadline was December 1st, and that's what we were pushing towards. They just updated it on the website where it reflects April 1st.
I guess just, so a follow-up to that being, brought to my attention. Has this been conveyed to like the many doctor's offices in the county that they're now gonna have to be tobacco free and that their employees are gonna have to be off of their premises for smoking? Because to comply with this, that's basically what it is. So they can smoke in their car, but not on the premises.
Yeah, they can't even smoke.
Yeah, that's what I'm saying, so, but not on the premises, so they would have to leave
Correct.
and then come back. So that is something that as an implementation, how has this been implemented in other counties to be followed?
So we have with medical offices and behavioral health, we've been going around giving out breathe easy and C signs. And they use that as signage at their offices. Are you under an umbrella like Scotland?
No.
Okay, so you could get individual signage for your office and you would have it and be in compliance. You also could implement a policy. I will say that, not every doctor's office has a smoking policy. I see when I go out and talk to individual offices that if they have someone who is already passionate about tobacco use, then they put it in place. But it may not be something that's already there, but I can work on the technical support side to make sure that you create a policy and you have one in place for your staff.
How are you?
You are a tobacco free, okay. Do you have signage up?
Yeah, like when you come in.
Okay, so you would comply with it?
But see,
You have some?
you're saying the entire premises surrounding the office area, that includes the parking lot, which, you know, for our office, I can tell you it's not covered, I don't think. I'm gonna have to talk to somebody about that tomorrow.
And I'm a pediatrician, so my patients don't smoke anyway, but.
I do want to add, Nicole, you can correct me if I'm wrong. But the Board of Health, you all can impose a smoking ordinance, because this is dealing with public health. The Board of Health has the authority to adopt smoking ordinance.
And that doesn't have to be approved by us.
Right.
This board has a.
Cause we did the bands.
That's, yeah.
Well, I mean, this pretty much makes it,
Yeah.
it
But
does.
you know, I find it interesting, I've not heard about this, so I'm really kind of interested in that, the deadline April 1st, because we're at the end of February, so.
And which organization is it?
I work for Integrated Pain Solutions, in Laurinburg, but we have clinics all in the eastern part of the state.
Okay. I know I, did receive a list of, it was behavioral health clinics. And I personally went to each behavioral health clinic that I received a contact for and gave them tobacco-free signage for their organization. And from my understanding, they got it from the Medicaid bulletins that come down from the state.
But you're saying any healthcare facility that receives Medicare funding
Medicaid.
as payment for services.
Yes,
For
ma'am.
clients,
Medicaid.
Medicaid.
Yes, ma'am. Mhm.
Off subject a little bit, but Dr. Bowling, if I may ask, I'm assuming your office does fall into this category, correct?
Correct.
Have you all been notified?
Not to my
Direct-
knowledge, but, you know, since I don't administrate my own office anymore, they have their own administrators, and it's a huge half of the US company.
Mhm.
I'm actually gonna send some information to Mass Sender Slide,
Yes, sir.
and, because I've heard nothing from anyone, and this is April 1st, and you never gonna make the rounds, so.
Right. I just wonder, do we have, Ms. Deaver, and Sheena, an obligation as the health department and public health to maybe have Ms. Cox help educate our healthcare professionals in town that this is in place?
Oh, absolutely.
Okay.
This should have probably, because it was initially, December 1 was the initial deadline date. They suggested that 3 months prior to that, we needed to start informing our staff and others, our clients or whoever was coming in, that this was coming down the pike in order for them to start getting ready to either get on, have resources for quitting, that kind of thing. So now that they've moved it to now April 1, here we are, you're right, end of February already. We're not giving people enough time. People need time to understand and get educated about so that it's not an uproar. So we really need to start pushing out stuff right now.
Yeah, and the biggest issue is gonna be, I mean, even just for general healthcare offices, whatever the specialty is that it's gonna be people smoking in the parking lot. And
I would
parents or other adults waiting to pick up people, and drop people off, and they're all gonna be in the
That's
parking lot.
Well, the hospital's doing pretty well, you know, with their campus. It's a smoke-free campus. It took them maybe a little bit initially, but now I think it's pretty much a smoke-free campus, and it's not any problems. They've got signage out there and all, so we have to expect that, and nobody wants to have to police people.
And that's what I was
But
gonna
if you-
say.
but-
So with each county I go to their board of health, I tell them, and then the staff as well, we are not the tobacco police.
That's right.
We are not gonna put ourselves in harm's way to stop people from smoking or vaping or dipping or chewing. So whenever you see individuals who are smoking on your campus, that's a time to educate, that's a time to refer to a quit line. You don't step in harm's way because of tobacco products.
Because all our schools are on tobacco free. Our schools are 100% tobacco free, the campuses. So, but they still do it, but
There's
we
all,
don't.
yeah.
I mean, more and more places are, and with signage out there in the entrance ways, coming in and us educating, and we can do that through the newspaper, radio, education individually, groups, whatever.
But the way this is written, if somebody had a pack of cigarettes in their car, even if they didn't smoke, while they were on the campus, they got into the car, it's tobacco free, no tobacco products allowed. So.
That's correct. And this
is going too far.
this is to encourage people to decrease their smoking habits or to go down a cessation path.
Yeah.
We are not, once again, being the tobacco police. This is to help people create healthier habits. Individuals who smoke at work, this is a time for them to choose other things to do whenever they decide to take those smoke breaks. Maybe take a lab, or I know in Charlotte, they have a wellness program that they started in Mecklenburg County, where the staff goes out, instead of going out to a smoke area, they go out to an area that has plants and things, trees planted where it's more peaceful, and they can go and take a break and decompress. So, and essentially, that's what people are doing when they smoke. They go out to let off steam, relax for a second, and come back in to continue their work. So we are not policing them. We are encouraging individuals not to smoke. We are encouraging them to seek cessation services. If the county does provide cessation classes, we're encouraging them to attend those as well. But we are not policing them and arguing and calling the police on them, literally calling the police. We're not doing that.
So with the health department, for example, since we're here in the health department. So, when the health department is audited and an auditor comes on the campus and there are 3 people sitting in the cars out here just puffing away.
I'm sure.
What happens in that regard when the auditors come in and take a look around and see that happening in the parking lot? Because, we have a lot of Medicaid patients in this county and the surrounding counties. So, since if you're offering medical service, you expect to be compensated. So what happens if someone comes in for an audit and there are issues 1 time, 2 times, 3 times when they come on campus? How is that going to impact the reimbursement for services at the health department?
So as of now, DHHS has not implemented a guideline on what the fallout will be.
So you're tying that to an agency being paid for their services. So what happens?
So as long as the agency is in compliance, they have the policy in place, they have the signage, they're encouraging individuals not to smoke and not to use those tobacco products, they're doing their part. And so it becomes a cultural norm for people to slowly stop smoking. If you have to get in your car, you only get a 15-minute break outside of your lunch. If you have to get in your car and drop to Walmart just to smoke, how long are you gonna do that?
It's not the employee, it's people,
But even-
people and their drivers coming in, somebody's transporting a patient over here, driving them in, they're sitting out in the parking lot smoking while they're waiting. It's not the employees, it's gonna be
I can tell you-
it's gonna be other people.
I can tell you, going on campuses that have all of the tobacco-free signage, you are still going to have one or two people that you'll see on any given day that's smoking or vaping.
Yeah.
I was out at the library, there's an ordinance out in the county, I was out at the library, and a lady was sitting on the bench in front of the library smoking.
In front of the sign, probably.
In front of the sign. And I know it's in front of the sign because I was working on accreditation. And I was taking pictures, and so I took that as an inspiration. I didn't take a picture of her. But people are going to do it, and that's a moment to educate, that's a moment to refer to the quit line, that's a moment, if Kathy's doing classes, that's a moment to refer to Kathy's classes. But we are not going to fuss at that person and tell them, to get off the premises and, yelling at them, we're not doing that.
So with that being said, they have your information,
Yeah.
and you're on the shack committee, right? With the schools, and
I
they
have
can
not
contact
been
you.
on Shack.
Yeah.
I was on at one point when I
I
worked
got your
here.
contact information,
Okay.
and everyone can continue to ask for questions. We're gonna move on to the next order of business. Thank you, Ms. Davis.
Thank you all.
And I will send you that date for commission.
Okay, thank you.
The next order of business is the conflict of interest policy. The policy acknowledgement. Ms. Amelia, on that one, you're sharing? Share.
Okay, so with the conflict of interest policy, there weren't a lot of, changes or policy or procedural changes or updates to, the policy. But I would like to, make note in the current or, most latest version of this policy, there were no board actions included in regards to conflict of interest. What would the board do if there was an event of conflict of interest? That part or that procedure was left out of the current version of the, this policy. I did do some research, to see what other health departments or Board of Health's, conflict of interest policies included. So, I came to this conclusion based on the duty to disclose, and the board actions in regards to, this policy and adding those two clauses into this policy. Any questions?
Well, do you want us to sign this?
Yeah, and I do want to make note, all board members, will be provided a copy of the conflict of interest policy, which was in your packet, and also be required to sign and or update their signature during the initial appointment or reappointment to the Scotland County Board of Health. I did include a, acknowledgement form in front of you. If you can, review, the acknowledgement form and sign. Mr. Ray's already done beat y'all to the front.
Yeah, we need a motion.
I'm sorry.
We need a motion.
Make a motion.
We have it is moved and seconded that we have a motion to adopt the conflict of interest policy. Those in favor of the motion say aye.
Motion second.
Second. The ayes have it, and the motion is adopted.
Once you sign it, would you pass it this way?
Yes, because I think, it's 3 signatures, the board chair, for each acknowledgement form, it should be the board chair, the health director, and the board member. So if once you sign, you can pass it to your left.
Next on
Okay, so I
the
don't fit in the whole.
agenda is test and go, is that what you're talking about? The test and go COVID-19, vending machine, we need to. make a
Y'all,
motion.
they're one of 7 cameras in the state that has this machine.
So we need a motion to adopt this machine. Or
It's
we don't
adopted.
need a-
It's just
Okay.
This is a short video
Okay.
to show you how it actually operates.
Convenient and cost-free way to test. Here's how to prepare. The Calc now offers COVID-19 testing from Test and Go kiosks. A super convenient and cost-free way to test. Here's how to prepare. Register ahead of time online and bring the following 3 items with you: your registration confirmation code, your mobile phone, and your insurance card. If you're not insured, you may still test at the kiosk. Note that people 15 years of age and younger must be accompanied by a parent or legal guardian. When you arrive at the test location, go straight to the kiosk with your confirmation code in hand. If you did not register in advance, access the registration app by scanning the QR code at the kiosk, or use the touch screen at the machine. Either will enable you to dispense a test. To obtain a test kit, hold your QR confirmation code up to the scanner at the kiosk. If the QR code does not scan, click Other Options on the touch screen to type in your confirmation code. Wait a few seconds for the machine to dispense, then retrieve the test kit and return to your vehicle or another comfortable location where you can open the box and follow the instructions inside. Now that you have the kit, let's review the steps to complete your test. Number 1, locate the test tube sticker in the box. Using your mobile phone, scan the QR code on the tube label. Enter or review the requested information. Verify that your name, date of birth, and contact information are correct. When you have successfully completed this step, you will receive a message stating finished, test activated. Step 2, write your initials and date of birth on the tube label sticker. Then place the sticker on the tube as shown in the instructions. Attach it lengthwise so the ends don't overlap. Step 3, blow your nose and clean your hands before proceeding with the specimen collection. Step 4, perform the test. To collect a sample, start by opening the swab package. Remove the swab and gently insert it into your nostril until you feel a bit of resistance. It should insert less than 1 inch for adults and about a ½ inch for children. Once the swab is in place, rotate it 4 times in a circular motion against the navel wall for 15 seconds. Remove the swab and repeat the process with the same swab in your other nostril. Once you have collected the sample, place the swab tip first into the tube and screw the cap on tightly. Step 5, check to make sure the sticker is on the tube and the tube cap is tightly closed. Place the tube with the collected specimen into the provided bag and seal the bag. Step 6, use hand sanitizer or a sanitizing wipe to clean your hands. Step 7, return the specimen bag to the kiosk with the test tube inside. Place the sealed bag into the receptacle labeled Return Specimen Here. As soon as results are available, you will receive a message from Test and Go at the phone number or email you provided. Most results are available within 48 hours from your test date. If you have not received your results within 2 to 3 days of testing, call our helpline at 800-402-0000. That's it. Test and Go anytime convenient for you. For more information, go to dph.georgia.gov, your local county health department website, or testandgo.com.
A little piece of it.
So the last item of business is the new family planning funding. Tim?
Yeah, this is just some additional funding from the feds for Title X to purchase more, family planning methods such as birth control as far as LARCs or either, depots or either, pills. This is additional funds they sent down through this year. So it has to be spent by March 31st. So there's a deadline on this money. So as soon as we get it, you approve it tonight, we've got to spend it like now.
How much is that?
1,049.
I move we accept it.
I second.
Okay. Those in favor of the motion say aye.
Aye.
Those opposed say no. The ayes have it and the motion is adopted. Is there any informal discussion? So anybody wanna move to adjourn?
I have a question. If you already have this COVID vaccine, you keep hearing on the media or whatever, that you can go get another vaccine, COVID vaccine. Is it recommended that we get a second vaccine?
And you had the booster?
Yes.
It's not recommended you get another booster, you only get one booster. They are planning to come out probably with an annual booster. That they'll do away with the primary series and it'll just be an annual booster.
So right now, that booster is kind of the top tier for that.
So is there more testing being done on the vaccine, Donald? What do you know about that? Are they still testing?
To make better booster, you mean?
Yeah, well, it was approved for emergency use. There wasn't a whole lot of testing done. So are they still testing the vaccine?
Yes, what they're gonna do with the annual boosters, they're gonna take the best of the best and combine them all and make one good booster, an annual booster, and then annually, I guess yearly, if it morphs into another variant, they'll change the booster to fit, like they do the flu.
Yeah.
Every year.
What's your input?
So, the booster, I know specifically even for us as kids, we no longer even give the monovalent booster. The only one we offer is the bivalent booster, which is the newest booster, which is the one when people say, should I get the new one? They're referring to the bivalent booster. And the bivalent booster is the one that has the original novel COVID that was in 2020 when everything hit. And it also has the Omicron variant in it, which is the one that caused the second surge and everything. And so the new booster is the bivalent booster. So yes, people should get the bivalent booster if you have not gotten it, because it does cover the Omicron variant. So it covers more. But as far as what it goes for, what they're saying is, yes, they are advising bivalent. So they actually had us remove all of our monovalent boosters, and the only thing we offer now is bivalent. And and likely you will be having to take one like every year, just like the flu shot, because it mutates just like the flu mutates every year. So that's kind of the thinking you should get into, is that it's gonna be more just like you get your flu shot and it's mandated everywhere. It's the same thing that will likely be for COVID going forward.
Or hopefully they'll have one combined.
And they are working on some that are combined, and they do have them, but the reason they're not out is for the same reason you brought up, is they want to test and make sure that they don't lose the, efficacy of either one of them by combining it. So they're working on having it where you only have to get one every year, but they gotta test it before they know.
Since there is no further business, the meeting is adjourned.
Oh.